Hello, Salem Kaiser, and welcome to the second edition of Senior Symposium. This one is focused on healthcare. Throughout the year, we are going to be offering probably monthly forums with panels like today of why seniors are important and what we have to offer in the community. And we're going to discuss very anecdotally, no script whatsoever. We're speaking from the heart to you, and we hope you get something out of it. Feel free to take out your steno pad and take notes, and maybe some of the information will be relevant to your lives or the lives of your loved ones. So my name is B. Lee Coyne. I'm a retired gerontologist, which means I deal with the aging. I've taught college classes on gerontology and been a counselor social worker in the field, medical social worker, for well over 30 years. And I want to introduce our special panel of guests today. We'll start over on the far left, not politically. Obviously not yet. We won't go into that double entendre there. This is Bill Dugan. Tell them what you do, Bill.
I'm retired consumer.
Yeah. And
Caregiver.
then we have Kellyanne Garthy.
Hello. Tell them what I do again.
What you all about?
I'm a nursing faculty member at OHSU, and I began my long career in healthcare at the age of 17 in long-term care. So I have.
Where did you do it?
It was in Kalamazoo, Michigan, at Borges Long-Term Care Facility.
Long way from home.
Oh yes.
Okay. And Lavinia Goto. Introduce yourself.
Okay, I'm Lavinia Gocho, and I am also a nurse, but I work with Northwest Senior and Disability Services.
Right.
We provide long-term support services in 5 counties, including Marion, Polk, and Yamhill, Tillamook, Classip, and Classip, yes.
Okay. And what exactly does Northwest Senior and Disability Services focus on? What is it? Why does it exist? Why is it there?
It provides long-term support services in a number of different settings, in the community, in adult foster homes or assisted living, also in home, where folks can stay at home and we can bring in services for them, and then also in long-term care or nursing home type settings. So even though Medicare will pay for post-hospital skilled nursing, most of the long-term care is paid by Medicaid.
Good. Okay. We're going to get back into more detail. I'm going to ask each of you the same question now. How did you first get connected with aging and the elderly? What was your point of that? Let's start with Bill. I know you're a valid senior citizen at this point. Did you have any early connections with the aging field, or you just kind of grew into it age-wise?
I just grew into it, right. Very lucky. I just read on the internet, never complain about being old. It's a privilege denied to many people.
It's true. John Kennedy Jr. died, and John Denver, two of my favorites at early ages. So I don't know what they would have been like as senior citizens. I could only guess. And Kellyanne, how did you get involved with the oldies but goodies?
Yeah, so as I mentioned, I started when I was a teenager working in long-term care, and I was at the time they called us, I think, CNAs or certified nursing assistants.
Yeah.
And I loved it. You know, I suspected I wanted to be a nurse from a fairly early age.
You were always precocious.
Thank you. So that definitely solidified, my suspicions, and I just loved taking care of the older population. So it's always been part of my practice.
Indeed. Lavinia, tell us about your early connections.
Well, I've been a nurse for over 30 years, and I also teach, but I teach healthcare administration. I have, from the very beginning, my area of specialty has been in community nursing, so I'm working with the long-term care community. So it's just always been an area I've really enjoyed. So I haven't done it all here, though. I worked for 20 years in Hawaii, and again, I was very much into their long-term care network there.
Interesting. I'll mention just briefly about myself. I was brought up by my grandparents in Brooklyn, New York, a place nobody's ever heard of. However, that was during World War II. I'm now 72, bona fide 72. And originally I was in the newspaper trade as a reporter, an editor, feature writer. And one day, the people at the Civil Service Leader in New York, I was assigned by my editor to cover something called the Retiree Sentinel, which was the plight of retired senior citizens. They had a special retired senior civil service association. And I began reading the letters to the editor, and it sort of tugged at my heart because several of those letters were about widows on widows' pensions and what a rough time they were having just eking out their existence. And it got to me, and I said to myself, Lee, why the heck are you in this ivory tower up there writing about it when you should be in the field doing something about it? So I went back to school, got a social work degree at Hunter College, and my first job was working at the Rochdale Village Senior Center, actually opening the doors there near Kennedy Airport in Queens, and that's how it all began for me. And if we have time, I will share one or two of my early experiences, my landmarks. But when you've been in the field for 30 years, certain client situations just are embedded in your soul, and they mark part of your professional growth. And I think maybe it's time that I free myself up and share with the general public. Okay. Tell us, senior citizens are all on Medicare, especially also disabled. What do you like about the current Medicare system, and what do you think needs to be fixed and brought to the repair shop? Let's start with Lavinia this time.
Whoa. In terms of the Medicare system, I mean, certainly it provides for coverage of major medical issues. So, I mean, and hospitalizations and so forth. I think in terms of perhaps what I'd like to see more of is a little bit more in the area of prevention, a little bit more in the area of allowing folks to have more self-determination so that they can, stay at home as long as possible. So, I mean, that's the area that I'd like to see more done. Hope that answers.
That's good. And Kellyanne, what is your overview of Medicare plus and minus?
Okay, so Medicare Plus, you hear a lot of anecdotal stories from patients that say things like Medicare paid for, this incredibly expensive operation, and I think that Medicare is really good about covering especially very emergent and traumatic sorts of surgeries. But I would definitely agree with Lavinia as far as their lack of coverage for preventative services. I think it's no secret that the government is often slow to change and adopt sort of new principles and new ideas into their system. And I would really like to see Medicare start paying out for maybe even a companion to go walking or things such as this that can really maximize preventative services, but also, as Lavinia was saying, autonomy and be able to bring the healthcare system back to the individual like that. So.
Okay. Is there any one illness that you think deserves more coverage for prevention that is a big ticket item on the Medicare system? What would that be?
Yes, my favorite one to say about that would be diabetes.
Diabetes,
and pre-diabetes. It's sort of almost like a gateway disease process in which if you get diabetes, then that could potentially set you up for a whole host of other comorbidities or other diseases that are caused then by the
Let's
diabetes.
tell the lesser educated people in our audience what comorbidity means.
A comorbidity is a disease process that occurs in addition or alongside another disease process. So for diabetes,
It's like a tag team of two diseases.
Yes, exactly.
I like to make graphic stuff.
Yeah. So for diabetes, a good one, or not good, I guess good isn't the best adjective, but a common one would be heart
Appropriate.
disease.
Okay, good.
Yeah.
Yes. And I think that Bill knows a little bit about heart disease. You came right to the heart of the problem.
Yes. I woke up in the middle of the night with chest pain. And I woke my wife and said, chest pain. And so we got in the car. I was still in my bathrobe and pajamas, actually.
You're
And
allowed.
we went, because we don't live far from the hospital on Leslie Street. As soon as I uttered the words chest pain, suddenly things began to happen over in the emergency room. And suddenly I was in a wheelchair and being whisked off and went through the whole battery of things they do. And it was determined that I would have some, what do they call it, stents put in. And so they made the appointment, and the nurse said, pack a small bag just in case when you go for the stent. What do they call it? The process of putting in the stent is, you know, don't you?
You mean going to the cath lab and getting
Yeah,
Angiogram.
cabbage. Yeah, no, not yet.
Angiogram.
No, what happened? Angiogram. Thank
okay,
you.
Sorry. I was going
And
too far with that.
So he did the angiogram and was in the middle of the angioplasty. And I didn't even realize I was asleep until he woke me up.
Could you tell us what an angiogram does so that
Yeah,
so
it's
that no cardiac patients
it's
could
like
be
an
educated?
X-ray of your heart.
Okay, good.
Is the
X-ray of your heart.
angiogram, and the angioplasty is the inserting of the stent through the groin all the way up
Okay,
through the narrow passage of a
Yeah.
major.
good clarification.
But he woke me up in the middle of the process, and his first words were, I just talked to the surgeon. They're getting a room ready for you upstairs, and they're saying maybe by the end of the week they can do the surgery.
Oh no.
Wow.
Well, and sure enough, I was suddenly in a
That was a
wheelchair,
quickie,
and
yeah.
we were in the elevator going up to the 5th floor. And the surgeon came in and said, well, maybe maybe in a couple of days we'll be able to, because I think I've had a cancellation. And then he walked out of the room. Then he came back in and he said, well, you know, I think maybe this afternoon we'll be able to do the surgery. And he walked out of the room, and 2 nurses walked into the room and said, we're getting you ready for surgery right now.
Yeah.
Went
Surprise.
from the end of the week to the middle of the week to maybe this afternoon to right now. And it all took about 10 minutes. And so suddenly I was downstairs, and they were mapping the veins in my leg, and they were getting me ready for surgery.
This is an inside job for sure.
What's it? Yeah. So at any rate, I was
Now,
very impressed by
Bill,
the fact
emotionally, was it hard to make the adjustment of now? Was it traumatic to hear you're ready for surgery? How did you adjust?
Actually, suddenly I was surrounded by people who were expert in what they were doing.
So you were comfortable then?
One was putting a stent into my, and she nailed it first time. I really
Wow.
admired that because as a diabetic,
Yeah,
I
watch that
am
out.
used to people fishing around because I go at least 4 times a year for blood, for, what do they call it? Bilirubin, is that it?
That's for your liver.
No,
So
that's not. That's not
probably
it.
not it.
Maybe an
AC1.
A1C.
Yeah, A1C.
Hemoglobin
Yeah.
A1C.
Right.
Uh-huh.
There we go. At any rate, I admire people who
And the
can
surgery turned out well?
get it. The surgery, the cardio guy was very, very pleased with it.
And the patients?
I was so amazed that this whole process cost Medicare about 115,000 to $120,000, which
Man, oh man.
they paid. Of that, my copay was minuscule, something like $200.
Well, I'm glad our money went for a good cause.
Yeah, and then from there, my insurance paid for, or Medicare paid. I don't know which. I think the insurance is the Medicare, for me to recover in sublimity at the skilled nursing facility at Marion Estates. And that was really amazing. They were so good. Such, it seemed like everyone there, the staff, was so right on top of what they were doing.
They
Really
knew their
skilled.
thing.
Excellent.
Okay. Yeah. You bring up a very interesting thing, and I'm going to ask us all about that. Maybe I'll start with my own experience. Home health care, after you get out of the hospital, a lot of people are still quite weak, and they need some additional help. They might need help in taking their medications on time. They may need help in bathing, dressing, cooking for themselves. They may get Meals on Wheels. They may not. Sometimes they need help in getting them to the doctor's office. And so those particular things really need to be addressed. And the home health care system, which is generally paid for by Medicare, if it's a skilled nursing practice,
That's correct.
is will be done. So I think we'll begin by asking Lavinia, as a veteran nurse, to tell us what's meant by skilled nursing and what kind of things are usually common in a home health care package.
Well, I worked in a home health agency for a couple of years, and in terms of Medicare rules, they're fairly specific.
Yeah.
And it's skilled services, so it may be skilled nursing, like wound care, that kind of thing, or it might be physical therapy. That's also considered a skilled service.
True.
Other skilled services like occupational therapy or speech therapy really can't be the only reason that you get home health. You have to have those other skilled services in order to be able to qualify. But it is nice, but if your needs are primarily more to assistance in daily living, such as meal preparation or even help with reminding you to take your medications or accompanying you to the doctors, that's not usually home health. That's going to be more like home care or even the long-term support services that Northwest Senior and Disabilities provides.
Yeah. This is a good opportunity for you to give, and I'll flash it on the screen when they do the video part. What is the phone number for somebody who wants to qualify for home health care and wants to have a case manager or whatever sent to their home?
Well, actually,
you know that by heart? Or you
no,
look it up?
I have to.
Okay.
Okay, so
Look at your cheat sheet, man.
Yeah, this is a wonderful brochure. This one actually talks. It's called ADRC, and
We'll hold it up to the camera.
yeah,
so
I'll
they
show
can get
you.
a close up.
Okay,
Close
can you
up
read
time.
that number because I don't
Come
have
on
my
in.
glasses on.
Shoot close. There you go.
Okay, and then here on the back,
ADRC.
ADRC. So you can call this number, and they'll have folks that provide information and referral. They'll determine what you're eligible for, and then get you in connection with the right people. So if you need a case manager, then they arrange for that. But it starts here, with just information and referral, because sometimes all you need is information.
Right.
And then if they need to, they'll refer you on to somebody else. It's a wonderful service.
Now, a lot of people in the trade of senior care know what case managers do or what case management is all about. Could you give us a brief explanation of...
You're probably better able to do that than me.
Well, I
but-
could try. Let's
Okay, well,
collaborate on this one.
I think that in terms of what I've experienced with, because I've followed around the case managers to see what they do, and they do a lot of assessment, certainly initially, but really finding out what the individual wants and needs, and then trying to help them connect them to those services.
Good.
So I think that's a major function. I think also they provide a lot of support, I think, in helping them make some of those decisions, which are difficult, I think, especially when they're having to face, well, do I, look for a facility to move into, or do I bring in some help so I can stay here longer? I think that that's one of the things that they're very good at doing.
Support system.
Yes. And then what resources are available to them in terms of transportation or Meals on Wheels, all of those kind of things, bringing, making them at least aware of what they can access.
A menu of services.
Yes.
Okay, I'm getting hungry just listening to it.
And what about you? What do you think they do as well?
Case management. Case management, I think, I'm going to take your word assessment because it's a fancy technical term for some people out there. We don't know, how many people out there are familiar with the system. Assessment means to evaluate, to sort of put a laundry list together of what you want, what you need, and what's available, and do a kind of a lesson plan for your future well-being, health, well-being. It's like you're essentially a teacher. You're teaching them, the client, the patient, what do you need, what's out there, what's realistic, what comes free, what you pay for, all kinds of special sliding scales and all. For example, I had a relative who would fall a lot. She's now getting physical therapy. That's beside the point. And what we found for her is, number one, she was getting too weak to do her housework. So the case manager from your agency, Northwest Senior and Disabilities, came in, did an interview, found out that, yes, she had danger of falling. She had a quad cane that helped her a little bit. But she was able, based on her budget, her income, to get 10 hours per month of essentially free or subsidized service from the state, and anything above that she would pay out of pocket for. So that's one thing. This was housekeeping. This was keeping the kitchen and the bathroom, the other rooms clean, doing vacuuming, etc., etc. In addition, she felt kind of lonely, so they hooked her up with something called the Senior Peer Program. And the Senior Peer Program is where trained volunteers once a week come into the home and they talk about whatever the interest of that individual senior citizen wants or needs. It could be sewing, it could be stamp collecting, it could be cooking recipes and whatever. Sometimes they help them to get a little bit more together if they're having some anxiety or depression about some changes in their life. They could work with them, not as full-fledged counselors, but as just support system to get that all together. The third thing I recall was cherry lift. And cherry lift means that you get, with 1 day's notice, I believe it is, you can get rides to doctors. And does also include shopping?
I think it's a week notice.
A week's notice?
Yeah.
Yeah, you were mentioning that you're using Cherry Lift.
Now we are, yeah.
Yes, and it's available for non-medical purposes?
No.
No, just
no,
medical.
Just medical.
Okay.
But they'll come to your house, pick you up, take you to your appointment,
So it's
wherever
door to
it
door.
is. Yeah, yeah.
And that's a wonderful
Very,
thing.
very
And
good.
they wait for you if you're late for your appointment, or what about the return trip?
And they will pick you up. Usually, they have other people to
Right.
work with, so they you might have to wait 15, 20 minutes.
Okay, so you wait in the doctor's office,
for them
waiting
to
room, and
pick you up,
and they
take you
come
home.
in and leave their vehicle. Okay.
Yeah, but
That's
my
important.
wife is very
That's
happy with.
important. What was her ailment, your wife?
She's had a series of strokes. Very, very. First one was a massive stroke,
Wow.
which left her paralyzed on one side and with what is called expressive aphasia. And,
Could you explain that in
yeah,
technical terms?
that means that the part of her brain that translates thought into speech doesn't
Was impaired.
exist anymore
Wiped
as a
out.
result of the
Wiped out.
stroke.
Uh-huh.
And so I will say this: the rehab that she received
Speech pathology.
got rid of the paralysis on the right side. I think within a few months she was, and you would now never know that she had experienced that.
Terrific.
But the aphasia was difficult, and she got, as a result of very hard work, because those speech therapists really, they work in a very deep,
They do.
probing way. I used to attend some of the sessions she had. And then there's a support group that we found, because she just recently had another stroke. And then when she had her heart surgery, they said that they found scar tissue from at least 6 other strokes that nobody knew about.
Wow.
And so she had a stroke in November, end of November, beginning of December. I can't remember the date. Just now, I mean, just this past Christmas, which left, which really, she lost some ground that she had gained as a result of work.
Sometimes you're aggressive.
But now we have Cherry Lift, which is great. And,
Do you have the disability sticker for your car to park
Yeah,
in?
we do.
That's another benefit
Yeah.
that we were guided by the Northwest Senior and Disability. They could help pave your way to get the
Sometimes that
disability
comes in
permit.
handy.
Less
Probably I
walking.
would benefit by parking way, way out in the parking lot.
Yes.
But,
Are you saying you're a way out character now? Yes.
yeah, I don't have any real complaints about the Medicare. I
Good,
really
okay.
don't.
I'm going to ask Kellyanne now. You brought up the hidden fringe benefit of support groups. And actually, Kellyanne is an adjunct to the diabetes support group. So maybe using that as an example.
Yeah.
What do support groups do and how do they get organized?
Well, our support group is a little bit unique, I think, to the typical model of support groups. So at Diabetes Support Services, we offer a whole host of topics for educational purposes.
Such as?
So on a monthly basis, there's a variety of places that Diabetes Support Services will go and provide education at the Center 50 Plus, at the First Presbyterian Church downtown Salem, and a variety of other places. And the topics revolve. So the topic from last month, for example, we had a periodontist come in and talk about the link between gum disease and diabetes. Yeah, and a lot of different topics that are things that you don't typically think of with diabetes that kind of reach out into those unknown areas. A lot to
Good
do with,
information.
yeah.
Okay. Now, this is the First Presbyterian Church. That's on, what is it, Chemeketa Street?
Yes, it's right across from the YMCA.
Okay, yeah, just, and it's given on a Thursday?
It is. It's the third Thursday? No.
The last Thursday
Yes,
of the
the
month.
last Thursday of the month.
The time is?
The time is from 7
7.
o'clock to about 8:30.
Free parking.
Free parking, absolutely
Meters
free
aren't-
everything.
Meters don't charge you at that hour.
Yeah.
It's
No
important to know that stuff.
charges. And at this
And
point,
you get a little food there, a little
there is,
sample food.
and I'm glad you brought that up because right now the Marion Polk County Food Share is donating a whole bunch of fruits and vegetables. So you can literally bring in a bag and fill it all up with fantastic bananas
Oh.
and carrots and everything.
Bill never goes hungry, right?
Rarely.
Okay. Did you want to add something about Lavinia? About support groups? You've You've dealt with them in your time.
Yes, I ran a program for it was for chronic disease self-management. So these were classes that focused on giving folks skills so that they could self-manage their disease. So we worked hand in hand with that. She the diabetes support services. We had a diabetes self-management program, and I think the whole point of the program is that. That with some knowledge, that folks can do a lot towards controlling and managing their diabetes. So we had some great success, and I think it's really, really it's often folks will get a lot of information when they're in crisis. Like they've had their heart attack, and now they're being discharged from the hospital. And by the way, here's all this information, and they're not ready to hear it.
Right.
We ran a program with one of the cardiology offices in town that actually took clients that were newly diagnosed and ran them through a 6-week program and really gave them all of the the things that they weren't ready to hear at the time, and I think it makes a lot of difference. The program is actually run by folks who have the condition. So they either have diabetes or they have heart disease, and they're talking about
They're
it.
not just, they're knowledgeable, but they're
They're
personally
peers,
affected.
yes, they're personally affected.
That's important to know.
Yeah, and there's nothing, I can talk about it, but I've never experienced what it feels like to have like one of those devices in you, like when your heart goes out of rhythm and
Now,
that
I want
kicks
to ask
in.
Bill a question about that. I assume that there are heart attack or cardiac support groups in town, probably 1 or 2 run at Salem Hospital. Do you know of any support groups for people with cardiac conditions? Are you
There-
I
aware?
don't.
There,
know.
there aren't that many, and there's one woman that ran one. It was specifically for women. She was a heart champion. She herself had had 6 heart attacks, but I think she recently had to discontinue it just because there didn't seem to be the support for it.
Well, if I were an advocate, and sometimes I am really, I would go knocking on the door of CHEC. CHEC stands for the Community Health Education Center. It's in what, Building D for diabolical foot disease. You have your choice. I'm being a little satirical. That's okay. And that's Building D of Salem Hospital. Give them a call. Come visit them. They have a lot of booklets and say, hey, I think it's time we had a cardiac support group here in town, and Salem Hospital is the ideal place to get it started or help us organize. And I think they can do the legwork and make it come off, make it a reality.
I think
What do you think?
The nice thing
Kellyanne?
about support groups as well is that they're free, whereas if you attend a variety of educational courses, sometimes they're very, very expensive, and
That's very
Medicare will
true.
typically pay for them. But those who are uninsured or underinsured may not be able to afford $1,000 to
Yeah,
learn
they're
all
not
about
okay.
diabetes or heart disease.
Right,
So-
right.
Yeah. Something on the other end of things, we've already passed the April 15th income tax deadline. But for those of you who plan to pay taxes next year, if you're generous enough and patient enough to do your itemizing of different things, did you know that things like going to not only the doctor and the dentist and physical therapy, but also the pharmacist and possibly even health-related support groups are good for medical mileage that could be under your medical deduction in addition to the medicines that you pay for and the co-payments there.
I
So
didn't know that.
consider medical support groups and the mileage that you accumulate, something you keep a little journal this year, and go by MapQuest and find out the mileage from your house to that particular location and submit it and see what happens. I think it's, or at least speak to your tax person and make sure it gets clearance from them. Just food for thought and a little bit extra money for your pocketbook. Okay. Lavinia, let's turn to some of the problems of the disabled elderly who are essentially homebound. We know they have Meals on Wheels. Are there any particular criteria to get Meals on Wheels these days, or is it just you apply and you automatically rubber stamp and you get it?
I don't know about rubber stamp, but in terms of if they want the meals at no cost, then certainly income comes into play. I think that they're on a sliding scale depending on your income.
Really?
Yeah.
Ah. I called Meals on Wheels to deliver dinner 5 days a week,
Yes.
and that's $90.
For
And they didn't ask me any
Per
questions
week,
about.
$90 a week.
No, a month.
A month.
Month.
Okay.
so
Wait a
that's
minute. I don't know.
It would be a
30.
month.
How many meals a day? Three.
One meal a day.
So it's about $3 a meal.
Uh-huh.
Okay. So that you're probably paying the full cost of that. That's
month.
probably why.
Oh,
You were
I
paying
see.
the full cost of it.
Yeah. It's all volunteers who come to the
Yes.
door.
Yes.
I really think, wow,
And some of the food is
isn't it
pretty
wonderful
good.
that people are willing to volunteer their time to do something like that?
Okay. I want to share a story from my early days in medical social work because it involves Meals on Wheels. The Meals on Wheels people are not only giving you the food, but they're giving you the oversight. They see how you are day after day. If you're declining, deteriorating is
Oh, yeah.
is a hostile word, but if you're declining or if you're dizzy or something like that, and if you don't answer the door, they're supposed to report in to your supervisor and say, let's check that person out. Maybe they are having a heart attack. Maybe they fainted and all. Well, there was this elderly gentleman, a widower, who lived alone in Jamaica, Queens, where I did my first 10 years of social work. And he didn't answer the door the first day, but the deliverer never told me anything, unfortunately. He didn't answer it the second day. The deliverer, volunteer, decided to leave the tray with the meal outside the door and figured maybe he was hard of hearing, maybe he didn't hear the doorbell ring. He would get it. The third day, the tray was still outside.
Oh.
And so we called, when reported to me, we called security. The extra kid, I let him in. They found the guy had collapsed in the bathtub, and they took him to the emergency room in the hospital. He died about 2 or 3 days later.
Oh,
But
that's
that
too
was
bad.
a warning to us, and we really were tough. We said from there on in, if you don't get an answer, tell us immediately,
Yeah.
and then we'll go in. We will.
Right.
This is in Rochdale Village, and we will find out if there's an emergency, because if the person lives alone and they have nobody who calls them regularly, they're at risk. They're in danger. And so the Meals on Wheels deliverers also bring some uplift to the isolation of many homebound people. We often
Yes, it
overlook.
really does.
They do.
Yeah.
And they become almost like friends, cronies, chronic cronies. I know.
Well, it's not merely a question of living alone. My wife, with many strokes, and then me with diabetes and heart condition. I mean, we feel the two of us feel alone, alone together.
I want to give you an idea that I have from the ancient past, and this would be true for any of our clients who live alone. I'm using the first name, confidentiality. Ethel and Minnie were friends in this community. They were both homebound. They were getting their Meals on Wheels, but they lived alone and they didn't have any relatives to check in on them daily. Ethel and Minnie made a deal. At that time, telephone calls, if you called and you spoke to somebody, it would build up your minutes of how much you have to pay for. And then if you went overboard, they don't do that anymore. You have unlimited on most landline phones, but in those days it wasn't the case. Anyway, the game plan was Minnie would call Ethel and give her a one-ring signal. Then if Ethel heard it, she'd give one ring back. That means the coast is clear and feeling okay. If either of them broke that sequence of that loop, then the other one would either go into the other person's house with the extra key, they're called key mates, to see that the person hadn't fallen flopped and was in danger, or they would call the security officer there to go in for them and see that there was no dangerous episode at play and maybe save their life or well-being.
Wow.
So this idea of a key mate,
Yeah.
if you or anybody you know happens to live alone and have a chronic risky condition, have them get a key mate, somebody down their block would have extra key, would call them once a day, once every other day, probably after breakfast, say, did you sleep well? Are you okay? Are you suffering anything? And have that as a kind of an honorary guardian angel. Why not?
That's a good idea. I would just kind of throw in the caveat that
Yes.
that is something that is easy for people to do who are capable of advocating for themselves. So people who maybe already have accessibility to other people in maybe their apartment community or long-term care community or whatever.
Yes.
But then when people are very isolated, maybe rural, that might not be as easy of an option. So are there any services that hook two people up together? Kind of a
Some
peer-to-peer
senior centers
thing,
have
or-
what they call not a friendly visitor or a telephone reassurance program. That's the old name. It may have changed.
Or
what
a
they call
buddy
it today.
system.
Yeah.
A buddy system. So now a lot of older people started out being well elderly in senior centers, and then they graduate downward. They graduate
Sure.
to being homebound, and so it's very possible that a now homebound, isolated sick person, once upon a time, was in the senior center and knew people there who they could contact and just renew those old contacts and make that their key mate. Because people don't just come to senior centers just to eat the food and run. They come to make friends, and it becomes really their extended family.
Yeah.
And we have to see it. Have you been to the senior center 50 plus?
Yes, we used to go at least once a week for lunch, and then we did a class called Writing Your Life Story.
Oh yes.
And those people were very well connected, and in the summertime, somebody would invite us over. We'd have a meeting at somebody's house out in the country.
Oh, that's nice.
Yeah, it was really, you got to know people because you were listening to their life story, and it wasn't done. That class there's no criticism.
Yes, yes.
It's just you writing what you experienced in your life. One woman who was a war bride came over from England to this country and lived for years and years, wrote about her experience, and somebody got a hold of it, and there's a whole big network of war brides, and she flew off to New York City for a convention
A convention of war brides.
Fun.
just
Quite an
just
affinity
out
group.
of this class, Writing Your Life
Oh,
Story.
that's really neat. That's
Yeah.
really neat.
So I think you bring up a good point, Bill, as is Kellyanne and Lavinia, and that is the senior center is a place we can make new friends and do some bonding, and in the process, any of those friends, several of those friends, could become your contacts when you are sick, homebound, hopefully not,
Right.
but when you need an added support. So give some person that you trust, could be a neighbor, it could be somebody from the other side of town, an extra key, and have them keep in contact with you. So if you should fall in your home or otherwise become disabled and need some rescue, a key mate, I call it key mate for lack of a more sophisticated term. But that's really a cool way to go.
I think it'd be kind of neat to have almost like a neighborhood watch. You know, you have neighborhood watch, making sure there's no strangers in the neighborhood. But you could also, I mean, we don't have as many neighbors as neighborhoods, if you will. The reason I like mine is because I know everybody, and I feel like if anything happened, I could go to any of my neighbors. So I think that that could be another way, is that, ask a neighbor, maybe somebody who's a little younger, and could, just check in on you. If they don't see you, that might be an indication. And it used to be like we had a neighbor where if a certain light went on during the day, we knew they were home and they were okay. And so if the light didn't go on that day, then, we would know enough to go
Yeah.
and check, So you could have just little signs like that so that, your neighbors could sort of watch for you.
Also,
If
I want to
may,
touch.
add
Yeah, go ahead, Bill.
another light there. In our neighborhood, which is the Gaiety Hill Historic District,
Near the library.
near the library, exactly.
Oh, okay.
We all know each other because many, many years ago, about 45 years ago now, the women in the neighborhood decided that they would meet for wine and cheese on Friday nights
I'll
after
drink to
work at 5 o'clock. Well, that became such a tradition that
A
now
little drink to that.
frequently the gentlemen are also invited, and it's become wine and much more than cheese. But what really happens there is you get to know your neighbor
Yes.
extremely well, as you say, which it doesn't always happen. I lived in New York many, many years and did not know the person who lived down the hall,
I've heard that.
like one door away, two doors away, across the way.
It's called cosmopolitan isolation.
Yeah, I'm sure.
Yes.
Yeah, but now I know people who live down the block, many people. And it's something I tell people about because when we have something happen in our neighborhood, like there was just a series of robberies and break-ins.
Right.
I opened my car door and everything was spread all over the place.
Oh.
And then it happened to someone else. And we have what we call the Leslie Street list. So people would email. And you send an email to the list, and it goes to everybody on the list. And suddenly, everybody is reporting that somebody a stranger walked to their door and tried the door, and things like that. Well, we went to City Hall. When we, Leslie Street now, go to City Hall, they know who we are. And within a month or less, within a couple of weeks actually, I was, because I work quite late at my computer and I have a view of what's happening down on the street. And I saw suddenly flashing a light bubble, red and blue. Hello. And I looked out, and sure enough, there's a young man, I'd say 28, 30, in a baseball cap, and the police had him because he was walking up and down at 1 o'clock in the morning, and they took him away, they towed away his pickup truck, and we never had another break-in. So
They
they
were
got the
wise.
right guy, yeah.
They knew the modus operandi.
And they were very vigilant, in
Okay.
other words.
Yeah. Let me bring up another somewhat related subject. It's a tough subject. It's elder abuse and neglect. Every state in the union on a local community level has something called Adult Protective Services.
Yes.
It does for the elderly and disabled what the Child Protective Services do for the young ones. And basically, it's there to be sort of a watchdog. It sniffs out suspected, not yet proven, suspected
Right.
cases of older people who are being abused or neglected. It could be by relatives, it could be by a caregiver, and it even includes self-neglect. So if you or anyone who you know might be neglecting themselves or having a caregiver or a relative neglected or health care or their other well-being needs, do call. It's anonymous. Your name does not get taken and publicized. So you're scot-free. And if you do it without malicious intent and just because you care and love and you're sensitive to that person's well-being, go for it. Lavinia, could you tell us a little bit more about Adult Protective Services from
So it's one of the services that we provide in this area, Northwest Senior and Disability Services, because we are the area agency on aging. And you, as you said, you can call the number and somebody will investigate within 24 hours. So they'll go out there and of course, if it's something that's imminent, you should call the police. That's that's if you want somebody to, if you're concerned about their imminent danger. But certainly, they will investigate it. It's even as you said, if you don't know all the circumstances, but you suspect something's going on, they'll make sure that they thoroughly check it out. And they encourage people to report because it may be that this is the third or fourth report on that individual that they're getting. So this way, they can put it all together.
Building a track record.
Yes. So I mean, I think it's really. So I mean, it's not necessarily saying.
Can you give us a typical case of what might be reported, or anything from your
Well, it could be.
experiences?
I went out on a case recently with the workers, and somebody had reported possibly financial abuse. That somehow someone was getting a hold of the seniors' money
Exploitation.
and using it for their own benefit. And so we did, we did go out, and we found the woman and talked to her. She goes, well, that might have been something that was related to a past incident, but she felt pretty confident that there was no problem now. But it was good that we went out, and at the same time you're checking on her, like you said. Every encounter is a chance to make sure that they're doing okay. So that one worked out. But there could be a number of different things. It could be sexual, it could be physical, it could be emotional. So there's a lot of possibilities. So I think it's better to be safe and just report it, and then let somebody investigate.
Do you have a
it.
number? Would they call? Would they? You don't know it by heart, but
I don't know it by heart.
okay.
But
If they were to call,
Adult Protective Services, yes, they could, or Northwest Senior and Disabilities.
okay, what is the number for Northwest Senior and Disability?
Well, you could call this ADRC
okay,
number.
let's get that number again.
Can you read that? Because I don't have
Okay,
my glasses
I shall
on.
read it to the audience out there, wherever you are.
Yeah.
Okay, the local number is 503-304-3420, 3420. Write that in the back of your hand, indelibly, keep it there forever and ever. Never take a bath. No, I'm not suggesting that. But make sure you could keep it in your wallet. It's a good number to have if you suspect anybody's being abused. I'm going to share. When you have a home health care team, it's usually led by nurses and the social worker and the physical therapist, and sometimes a chaplain, if it's hospice, form part of the team. I had a case down, I think it was Glendale or someplace in Douglas County, worked for Douglas Home Care and Health a few years back. And the nurse and I found that a family that was supposed to be caregivers to this elderly lady in her 80s was very sloppy, left a lot of the food around the house, and on top of everything else, never fixed their screen so that flies and other bugs would come into the house and land on the scraps of food that were left abandoned, and it was just an unhealthy, unsanitary situation. So we reported that, it was investigated, and the lady was removed from the house, that she could no longer be taken care of by her relatives, and they put her in a temporary bed that they had in a nursing home. Apparently the county's social service department had an arrangement with nursing home to have 2 extra beds for emergency high-risk situations. And this lady was pretty far gone, and they didn't want to trust her that the family would suddenly see the light overnight and become things. So I think then they later got into caregiver, and they moved her back, but they didn't trust, I think it was the son and his grandson that were doing a lousy job of taking care of this lady. So how would you respond in that kind of situation if you were the social worker, Bill? I'm putting you in the hot seat, giving you a hard time.
I don't know anything about social work. I
Uh-huh.
really. I'd have to study. I'd
You'd
have
have
to
to study.
research
Okay,
before I answer
you're off the
that.
hot seat. Your
It's-
yoke is removed.
It's definitely,
Kellyanne,
it's frustrating, you know, because you get your personal feelings involved as
Yeah,
well.
yeah.
But, you know, having worked most of my career in the hospital, when we would get cases such as this, it was typically to the point where they were being admitted to the hospital because of the abuse or because
Different
of
situation.
the neglect. So we would notify the proper agency, and we would bar those family members from coming to visit in the hospital. But one case, this was an extreme case that I had in Florida, the woman had skin cancer, and it had eaten away her nose and very large portions of her face. And the family, they seemed well intentioned when you spoke to them, and they said, "Oh no, she's independent. She wouldn't come. She refused to come." But ultimately, they were implicated in neglect because it was still their responsibility as a loving and caring family member to notify somebody that this is happening. So they ended up having to be supervised visits and that sort of things,
Good.
just like you would with a child.
Yeah. Okay. I want to give a preview to our audience of things coming up. This will probably either be a monthly or twice monthly series. Down the line, we're going to have a senior symposium on the topic of mental health and aging, including dementia issues and other things. Depression is a really big underreported problem among the aging population.
Yep.
And I think I'd like to have one or two lawyers and maybe even a recipient of legal services talking about wills and powers of attorney and things of that nature, because that could also be valuable to us all. So, but I would ask each of you in the audience to give some deep, deep thought to topics you'd like us to handle that reflect your personal interests, and drop me a line or leave your message for the station. B. Lee Coyne, that's spelled C-O-Y-N-E, but pronounced like C-O-I-N, care of CCTV station, and this is 575 Trade Street, Northeast, Salem, OR 97301. We're right here in downtown between High Street and Church Street. I want to give you all a chance for closing remarks. We will start with Lavinia this time. What did you learn from our discussion today, and what thoughts would you like the audience to go away with from today's presentation?
Well, I think today, when we were talking about neighbors, and it's a reminder, I think, that I think we all are each other's brother's keepers. So, I think we should watch out for each other, and it shouldn't be something that we have to be paid to do or be even reminded to do, that we're all part of one community. So I think, that's the one thing that this brought to mind for me.
Yeah, I would definitely agree with that as well, but then just also add, especially for healthcare providers, that older people, want to maximize autonomy as much as possible, and I think that it would be good for us to shift our focus at some point to spending more time and effort at providing preventative services and helping people get on their feet, so to speak.
Bill?
I'm very happy to have met both of you and to hear from you
Likewise.
about the services that are available for seniors. It's quite a different world now from the one I grew up in.
Okay. This is Lee Coyne, your host, signing off for Senior Symposium. Focus on Healthcare. Hope to see you again, or you will see us again in one form or other, and may the rest of your days be healthy ones. Thank you for tuning in. Bye for now.